Have you ever wondered how to improve the patient experience at your healthcare facility? Patient experience is key when it comes to a successful healthcare practice and healthier, happier patients. In today's video, we'll take a closer look at how to improve the patient experience at your organization through a few easy to implement practices. I'm Raid from Jotform, and let's get started. A better patient experience can improve lives, protect your business, and make employees happier. Healthcare organizations have been under pressure to take a closer look at the efficacy of patient experience. In an effort to ensure proper licensing, meet clinical expectations, and reach profitability. In recent years, CAHPS surveys have become more visible and important to healthcare organizations. These reports incentivize medical providers to boost their facility scores, especially as their compensation packages become more tied to these metrics than in the past. Further, the patient experience determines the risk of malpractice, employee satisfaction, and patient loyalty. And more importantly, it's been shown that patient experience can have a measurable effect on a patient's outcome. A positive patient experience means that a patient is more likely to follow their treatment plan. Even more, patients do a better job of managing their conditions when they believe they are receiving better care overall from their providers. To improve the patient experience at your practice, you need to start by encouraging your team to change their mindsets about patient feedback. For patient feedback to make an impact, your staff needs to see it as a useful tool. Doing so can be a challenge as surveys tend to include negative feedback about a patient's visit. So, how can you ensure that your team reviews this data in the best way possible? Start by clearly communicating the advantages of patient surveys. CAHPS surveys are specifically intended to help healthcare teams notice gaps, form strategies for improvement, and determine how any changes might affect the care a patient receives. Surveys exist to provide the knowledge that will empower your team to make meaningful change. Then, you'll want to begin focusing on the whole rather than the individual. Providers are most likely to feel resistant to patient surveys when they believe the patients are directly criticizing them. To counteract this, take the focus away from the provider and redirect it to the healthcare services you offer as a whole. A broader scope can help to paint a picture of what might have gone wrong, as you'll be factoring in more than one element of the patient's experience. One example of what this might look like is when a patient gives their visit a low score due to either a scheduling conflict, waiting room frustration, or lack of pre-visit communication, despite the fact that they did not have an issue with their provider. You should also use technology to make the patient experience seamless. A patient is more likely to perceive a visit as positive when their intake process is pain-free and their medical paperwork is easy to complete. Digital tools like online forms can make it easier for patients to fill out paperwork and reduce work for the medical staff. Hospital staff could also consider sending out patient updates when their appointments are delayed or pre- and post-visit materials that provide them with more insight into their conditions. Similarly, you should make analog tools digital whenever possible. To really benefit from patient feedback, you will need a simple way to collect and review the information. Try making the survey process easier for your patients and your staff by using Jotform's HIPAA-compliant survey templates. Templates are a quick and easy way to get the patient survey data that you need. Most importantly, be sure to show empathy. Most patients tend to feel that their providers lack empathy during their visits. So ask thoughtful questions to better understand a patient's situation. And when you disagree with their assessment, clearly explain why that is. When a provider shows a patient that they're listening, the patient will be more inclined to feel that their provider is actually taking care of them. While these methods aren't necessarily groundbreaking, they do highlight the need for providers to develop a broader perspective on patient feedback. Both positive and negative input can give your organization insight into how well it performs and provide clarity for your vision of the future. However, Try to use tools that won't add too much to the workload. Digital tools can improve the patient experience and do not require a significant amount of added work. If you're wondering where to start, Jotform offers HIPAA-compliant digital forms to help your organization collect better patient data. Jotform's forms are easy to use, secure, and accessible anywhere, so don't hesitate to give them a try. Let's briefly review what we've covered today. A better patient experience improves lives, protects your business, and makes employees happier. To improve the patient experience, there are a few simple steps you should follow. Clearly communicate the advantages of patient surveys with your team. Focus on the whole and not the individual. Looking at the bigger picture can help feedback to feel less personal. Use technology to make patient experiences seamless. When forms and medical history are easier to fill out, patients are more likely to have a positive experience. Make analog tools digital. Provide patients with digital surveys like those offered by Jotform to ease the feedback process. And lastly, show empathy. Patients are more likely to have a positive experience when they feel their provider truly cares about them. Again, I'm Raid from Jotform, and thanks for watching. We hope to see you back here again soon.